Chapter 17, Communicating Assessment Results. So since we've explored a bunch of different types of assessments throughout this course, it's important to take a moment and talk about how to share outcomes of assessments with our clients. And these involve special sessions that involve offering that feedback or interpretation of results for the client. So ethically speaking, we can't just give a client an assessment and then hand them a report and let them go on their way. It's really important to explain what the assessment outcomes mean and what they don't mean and provide them in context of recommendations that you are offering. This does not happen all of the time, and that's why we often will have clients come into our offices with copies of assessments and say things like, I really don't know how to interpret this. And so as counselors and ethical counselors, it's really important in both school and mental health contexts to be sure that you're taking the time to offer feedback sessions to your clients. So this involves educating your clients and or their families about assessment outcomes and taking time to answer questions and carefully walk them through the outcome assessments, any type of report that you've created, and explaining those things in the context of their own lives and situations so they can understand what that means. So for example, if we're screening for something like depression, our client may or may not have a firm grasp of what the concept of depression really means in a clinical sense. And so it's important to provide examples or to put that in context of things like, okay, so you met the criteria of depression. That means there are things you're describing, like not being able to sleep or sleeping too much, differences in eating, feeling like it's hard to get out of bed, difficulty with your hygiene, and these kinds of things are really pointing us in the direction of depression. You also want to make sure to talk about things considering cultural considerations. And so cultural competency and cultural awareness is a huge part of everything that we do, including assessments. And so if you know an assessment is not necessarily normed on someone's cultural group, for example, it's important to make that context. A primary example of this is recently in my practice, I've used a child behavior checklist with an adolescent to screen for some different diagnostic things that might be going on with this client. However, this client identifies as non-binary, so neither male or totally female. And so the way that the child behavior checklist is scored, there's a male and a female scale. There's a scoring guide for males and females. And so we had to have a discussion about which scale and which scoring guidelines would you prefer me to use, knowing that neither of these will fully capture your experiences, but which one feels like it might be the closest to indicators of diagnosis for you, and then we can talk through what those things really look like in your context. So that assessment was not really designed for someone who doesn't identify as wholly as one gender or another. And so we had to have that cultural consideration in the way that we use that assessment. And I also included that in the report that I wrote for that client as well. So things like that represent cultural considerations that need to be included in these feedback sessions and in your reporting. And then you always want to talk through recommendations and referrals. So if the things particularly coming out in these assessments go beyond your purview or beyond the services that you offer, as an ethical counselor, it's really important to offer referrals so that that client can be getting access to resources to address those things that come out in the assessments that you're offering. Same in a school context, if what that child needs goes beyond the purview of what you're able to do in your role as a school counselor, then it's really important to follow up with recommendations for their teacher to support those things or referrals to either other services within the school or referrals outside of the school to address those needs. So getting into more detail about how to offer effective feedback to your clients, This really should be an exchange. It should be a conversation between you and your client or their families. So, first of all, it's really important to take time to translate the findings into language that clients can understand. You all have been doing a really great job with this when it comes to your practice. As we discussed, you want to always consider cultural awareness in the way that you're interpreting the assessment or the way that you're applying that assessment outcome to your client. You want to always invite opportunities for the client to either agree or offer discrepancies with what you found. So you want to check in and ask, does this line up to the way that you've been experiencing these things? Does this seem accurate to what's been going on for you? Does this seem to capture your experience? And if there is disagreement, it's really important to take that into consideration and talk about what that means in terms of the assessment. This might represent something like resistance to treatment potentially, or it might represent an issue with the assessment and the way that it was administered or the way it's representing the client's experience. It's important to approach feedback sessions with empathy and use those good core counseling skills, use good active listening, offer a space for the client to have emotional reactions to this information. It's not just reading off test results. These things have real impacts for our clients and their lives, and clients may have strong reactions to those things. In some cases, they may have strong negative reactions and feel that these are really bad news and really devastating for them. In some cases, clients will be happy about the outcomes of assessments because they either indicate perhaps progress towards treatment goals, or they might find relief in having an explanation for things they've been struggling with for a long time, but never really had a name or a cause to point to. All of this means that it's really important to take your time. Make sure that you've scheduled plenty of time to work through these things with your client. And the more complex the assessment is, the more time it's probably going to take to discuss those things with your clients. So it's really important to schedule sometimes an entire session dedicated just to talking about the assessment process. And it's really important to stop and check for understanding with your client. Some of these assessments are very complicated and they involve a lot of clinical language. And so if we're just reading through a report, our client may not capture all of the information that we're sharing with them. So it's really important to stop periodically and use those good core counseling skills to check with your client to see how they're understanding and internalizing what you're sharing with them. Similarly, in providing assessment results to parents when you've done testing with children, you want to go through a similar process. So first you want to establish rapport with the parents and explain to them the context of your work with the children. In some places, you may have connection with the parents all along, and sometimes in school settings, you've done standardized testing and you have to talk through assessment results without having an established rapport already. So you want to take some time to establish rapport, at least a little bit with the parents, and explain the context of your work. Then communicate the assessment results using the guidelines that we just discussed. You want to discuss the recommendations for that child based on the assessment results. Again, this might be from a school counseling perspective and talking about different supports that a child might need or different resources that they have access to. In a mental health setting, this might have to do with recommendations for treatment or resources or referrals. And then you want to terminate the interview unless you are going to have an ongoing working relationship with that child. When discussing particularly negative outcomes to different types of assessments, it's important to approach this process with empathy. So first you want to explain what cutoff scores mean for different types of assessments, how those are calculated, and what they indicate. And then you want to talk about not just the outcome scores, but the strength of the outcome scores. So sometimes an outcome score is maybe just drifting into a problematic range within a certain assessment, and sometimes they're off the charts. So it's important to talk about the strength of the outcome scores and what they mean for that person. Maybe they just have a few indicators of an issue, or maybe they've checked every single box indicating that they need some type of support. You want to be aware of using negative terms that are stigmatizing. So avoiding language that's very pathologizing and explaining in terms that a client is going to be able to understand. So we want to avoid unnecessary labeling of our clients in the way that we are interpreting assessment outcomes. You do want to allow space for disagreement from the client. It doesn't mean that you're going to change your interpretation, and it doesn't mean that you have to agree with the client, but it's really important to offer space and empathy in their disagreement. So using those good core counseling skills as you're interpreting and discussing this with your client. And then you want to consider and assess the client's insight when it comes to outcomes. Maybe giving the client opportunities to talk about what those mean for them, because they might have really important insight about their own goals or their own treatment or their own interventions that are needed, considering things that have worked before in the past or considering assessments they've had before that maybe you are not a part of. So shifting gears to talk a bit about development and writing of assessment reports. You all have gotten some practice at this in our class so far. So the purpose of assessment reports go along with interpretation. So typically interpretation sections are talking through an assessment report. And so these really document assessments and their outcomes. And it's really important for you to, of course, provide a copy of this assessment report to your client, but also for you to keep a copy of it as documentation of your work. So it's important to have a copy for yourself as well as your client when you're offering these interpretation sessions. And assessment reports really provide documentation for the client in terms of outcomes, recommendations, and referrals that they might need to go seek other types of services. So that documentation is not just for you, but it is for the client as well. So in writing an effective report, you want to avoid jargon as much as possible and use developmentally appropriate language so that your client is able to understand everything that's in the report. Reports really should be concise, so you don't need extraneous or unnecessary details. Just talk about things that are pertinent to the assessment process. You want to provide evidence and context, and so this involves offering information or client background. If you're doing assessments, hopefully you're able to do at least somewhat of an intake or somewhat of a biopsychosocial assessment, so you have some sort of context and background information about the client as evidence that you can put into this report as well. At a minimum, you should have things like how old they are, if they go to school, if they go to work, those kinds of things included. You should also include things like the date that the assessment was completed and anything behaviorally that you noticed in your interactions with this client. You want to refer to yourself in third person. So the clinician did this, the clinician did that, the client did this. That's typically the language used in assessment reports. Whereas if you're more using, if you're doing things like treatment notes or case notes, you might refer to yourself in the first person. You want to always capitalize the names of assessments. So if it's the official name of an assessment, you want to make sure it's capitalized. So things like child behavior checklist should be capitalized. And you do want to somewhat follow APA in that you want to spell it out the first time you use it to establish an acronym, and then maybe you use ASVAB or you use CBCL throughout the rest of the report. And you want to include any kind of observation information that you might observe if the client's taking the assessment in your office or if you have pre-existing relationship with them. You might even decide that you need to edit your report based on the information and the way the client reacts to the outcome that you're sharing with them in the interpretation session. So that is an option too, to give them the report as a follow-up to your interpretive session if you want to include that observational information as well. So first, you're going to want to talk about the title and identifying information, which will include the identifying information of your client as well as yourself as the clinician. You want to then discuss the reason for the assessment. So in theory, this is why they were referred to you or why you're completing the assessment. So this is because the client asked for it. This was because they need to complete this as a condition of their probation or parole. They needed to complete this as a screening tool for the school that they're in. They needed to complete this to obtain access to gender affirming care, whatever the case. So you want to document in this report why you completed the assessment. Then you want some background information, some basic biopsychosocial background information on your client. And this doesn't need to be in a great amount of detail. It's just whatever is relevant for interpretation of the assessment. Further, you want to note behavioral observations. So this is particularly if a client is completing an assessment within your office, you might note things like they're oriented to time and space. They did not seem to be under the influence of any substances. Generally, they seemed calm and focused, or quite the opposite. Next, you'll want to talk about the assessment instruments that you used. This might include norming. So you might say, I used this assessment. It is recommended for use with clients that are between the ages of 12 and 18 years old, and therefore it was appropriate for this client who's 15. You might also include norming information related to things that are important to note, such as this instrument is designed on a gender binary and this client is non-binary, but in discussion with the client, it was determined that we would norm the client based on the girls scale. You also want to talk about procedures. So did the client complete the assessment in your office? Did the client take a questionnaire home with them, fill it out at home and bring it back? You want to note the dates and any type of procedural information about how the assessment was given. Next, you'll talk about the actual results of the assessment. So very clearly, like this is what the assessment says. And then you as a clinician interpret what they mean. Does it mean that they qualify for certain types of interventions? Does it mean that they qualify for some type of diagnosis? Does it mean that they have a substance use issue? Or maybe not. So you want to interpret both results that indicate the presence of something, as well as results that indicate that maybe there isn't an issue or maybe there isn't something present for this client. You generally will have a summary. So this is maybe a paragraph that just kind of offers a quick summary of such and such client came to me looking for this type of assessment. This is what I used, and this is what it said. And then in terms of recommendations, this is where you talk about potentially, I don't see any reason why this individual wouldn't be able to pursue gender affirming care, or I recommend this child needs to meet with the IEP team in the school, or they qualify for a certain level of MTSS supports, or I recommend that they need level 1 substance use treatment. Whatever your recommendation is for as a clinician based on the outcomes of the assessments, this is where you very clearly state that in your report. So all of these things are important elements of an assessment report. This might be longer or shorter depending on how many assessments you used. So if you gave a battery of assessments, your report might be a bit longer because you need to make sure to interpret each one and then talk about recommendations when you consider the assessment battery as a whole. And generally, you'll just want to make sure that you're using good professional language, checking for typos, making sure that you're using good grammar, and making sure that you're doing a really good proofread of everything before you print it out to share with a client.